Hi everyone, this is Matthew Zepp from the Core 24 Fitness channel. This is going to be our first exercise program for seniors, first in its class. We're planning on putting out a whole bunch more, so this is very much so an entry-level class for seniors. As you can see, all I have right now is a chair that I can use, and if you don't have the roller sticks yet, I'll show you a way to use just your hand that can work the same way as the roller sticks can be used. So what we're really looking to do here first today is when we take the stick, we're going to give a particular part of our body a light rollout. It's kind of like giving yourself a self-massage. If you don't have the stick right now, without the stick, all I'm going to do with my hand is kind of rub up and down on the top part of my thigh right now. That's your quad muscle. With the stick, we're trying just to move around some of that interstitial fluid in the muscles. It's very therapeutic, and for our workout that we do today, again, we can use our hand. It's going to play a big part in warming up the muscles. So we're switching to the other leg. When I'm rolling out the thigh, I can change the angle. There's four muscles we're concerned with targeting here in that quadricep. We're hitting the inside of the thigh, we're coming across the top, and we're hitting the outside of the thigh. Same thing, if I don't have a stick, I'm just going to take my hand and kind of roll out and rub out the thigh. You'll start to feel a little bit of warmth developing from the friction of the hand. I'm trying to get some blood flow. With the heel of your hand, you can kind of dig into that muscle a little bit too. Now we're going to switch to the second part of the leg underneath, the hamstring complex. Again, we can roll on the inside, we can roll in the middle, we can roll on the outside. We're approximately running about 20 to 30 seconds per roll. It's not super important that we're right on the time. You can switch when I switch. Rolling the leg out, or I can take my hand and kind of give that hamstring a little rub down. You can squeeze the muscle a little bit. You can even actually just grab it and move it around. You can shake it back and forth. We just want to get a very passive movement of that muscle to get the blood flowing and move around that fluid. Since our bodies are made up of 70 to 75% fluid, I forget what the number is, but it's much higher than 50%, that fluid needs to be moved around. Very much so, we're switching legs, very much so like the water in a fish tank. If you don't have that filter on in the fish tank, that water gets real stagnant, develops algae. You don't want algae in your body. Well, that's not going to happen, but we're going to move that fluid around anyway. So we just hit the top of the thighs, the bottom of the thighs. We're going to switch now to the inner thigh. I'm going to wake that inner thigh up. You can even pat it down a little bit. We want to get some blood flow in there. With the stick, we're going to roll it out. Again, we're running anywhere between 15 to 30 seconds on a roll. Sometimes it's a little shorter, and switch to the other leg. And roll out that section of the thigh. And once again, I got my hand in there. I can squeeze it, I can pat it down, I can roll it out. And then we're going to switch to the outer thigh the same way. About 15 seconds of rolling. Sometimes you'll actually roll over a spot that might be a little more sensitive. That could be a muscle knot, that could be some adhesion in there. You can stop there for a minute and apply a little more pressure. Just make sure it's not a bruise you have. Maybe you knocked into a chair the other day and you have a bruise there. It's not going to make you feel any better to roll the stick into that bruise. But if there's a little knot in there, we can roll that out. Switching legs to the left side, same thing. We're going to roll out that outside part of the thigh. We have the IT band there, the tensor fascia muscle. As I get closer and closer to a joint, I can slow down as I get close to the knee joint because I'm getting into that tendon insertions. What you don't want to do is, if you feel any kind of bony protrusions like on the outside of the knee, that's the bone sticking out. You don't need to roll that out, it's not going to make you feel any better. Or you take that hand and wake up those leg muscles. Now just to come off the sticks for a moment, I'm going to put that stick down. I'm still in a seated position, posture upright. And normally what we do in our classes here, we try to wake up the ankles and wrists, with a combination movement. I'm going to open up my hands as wide as I possibly can, trying to stretch that webbing in between my fingers. We're so often closing our grip up, we never try to work the outside openers of the grip. So we're going to open and close, open and close, open and close. Now as I open, I'm going to lift my toes off the ground, firing that muscle in the front of the shin. As I close, I'm going to lift my heel off the ground, firing the muscles in the calf. Open, I close, I open, I close, open, close, open, close. And we're going to continue that for about the next 20 seconds. Working the muscles in your forearms, working the muscles in your lower leg. So again, there's not really any resistance on either of these movements, but we're getting some blood flow in those long part of our extremities, which tends to have difficulty getting blood flow. That's why sometimes they swell. 5 more seconds. And relax. And while we're still sitting in the chair, one more thing we're going to do is we're just going to go to an open shoulder roll. I'm going to elevate my shoulders. I'm going to pull them back. I'm then going to depress them, push them downward, and then I'm going to pull them forward. So I'm coming in, it's almost more like a square pattern, rounding out my shoulder blades, lifting my shoulder blades, pulling my shoulder blades back, and then putting them down. So we're going to go through about 5 more of those rotations, trying to get the shoulder blades to get used to 4 very particular movements. And those movements are, again, protraction, kind of like making bad posture in your upper back. Elevation, that I don't know movement, shrugging upwards. And here comes the more important ones, retraction, pulling your shoulder blades back. And then when we want good posture, we pull them back and we want them down, which lifts our ribs up and lifts our chest up. Do one more rotation, protraction, elevation, retraction, and then depression. Now, I want you to get up out of your seats. I don't want to spend too much time in the sitting position because that's not really a weight-bearing movement. So even as I stand up, there's a lot more beneficial effect with exercise when my body's holding up my body weight. So what we're going to do from here is, if you need to use the chair, you can still hold on for balance. I'm going to balance on my left leg, which means my thigh should be tight and it should feel strong. I'm going to lift my right knee up. As soon as my knee comes up like a marching stance, my toe should be up with it. Always remember, when your knee comes up, your toe comes up. Like you're trying to push your big toe through the top of your sneaker. We want to avoid taking a step and dragging our toe. That's how we catch things on curbs, on sidewalks that are raised. That's how we tread. So we're going to practice knee up, toe up, and down. Knee up, toe up, and down. That's 2. We're going to do 5 of them on the right leg. That's 3. That's 4. And that's 5. And then I'm going to have you turn around to face the opposite way. Same thing. Inside leg is strong. Now my left knee and left toe comes up. Left knee and left toe comes up. That's 3. That's 4. And that's 5. Next thing I'm going to do is I'm going to turn. I can keep both hands on my chair. I'm going to raise my heels up. Do a nice easy calf raise. Heels up. Calf raise. Heels up. You're firing the muscle in the back of the leg. Going into a toe pointed position and elevating our body weight. That's 6. That's 7. That's 8. 9. And 10. Now, right after that calf raise, I'm going to show you one of our posture correcting movements. If I'm walking or jogging or running, you can tell by how someone's posture is based on where their palms are facing. If I'm walking and my palms are facing behind me, my posture is poor. If I'm walking and my palms are facing each other, then my posture is showing the correct position. So what I want to do right now is I'm going to start in that bad position. Palms back, shoulders kind of shrugged forward like a caveman. Then I'm going to turn my thumbs out. As soon as my palms are forward, I'm going to squeeze my blades back and lift my ribs up into good posture position. Then I'm going to recover. I'm going to turn my thumbs in. I'm going to let my shoulders shrug a little bit. Now I'm in the bad position. I should never be comfortable here. Then I'm going to start to correct it by rotating my arms out. Palms come out. Squeeze my blades back. That's already 2 of them. I'm going to round out, turn in, slouch, recover, shoulder blades back, ribs up, arms rotate out. And you're definitely going to start to feel some tension. In this position, rounded forward, you might feel a little bit of tension building up in the chest because I'm squeezing them together. Then much more important, as I recorrect and I turn my thumbs out, those muscles in the shoulder blades, the back of my arm, your tricep muscles are all squeezing to help correct that position. And I can even take a nice, good diaphragmatic breath in to elevate my ribs and recover and slouch. We're going to do that one more time. Bad position, caveman position. Don't get comfortable here. Recover, turn your arms, thumbs are back, triceps tighten up, back tightens up. Take a breath in through your nose, lift your ribs up, and then exhale out. Okay, next thing we're going to do, again, this is our most basic class we're going to start with. There are going to be more videos. I'm going to have a seat back down into my chair. Now from here, probably one of the greatest exercises we can practice is just learning how to get up and down in a chair. So what I want you to do right now is our positioning is going to have our toes slightly turned out. Because my toes are out, my knees are going to follow that same direction. I want to keep my hands on my knees right now, getting ready for the stand-up. Before I stand up, I want to lean into the bend. So I'm bending at my hip. I'm starting to transfer some of my weight forward, and I'm keeping my chest up as I do that. In a standing position, the most important thing if we're going to squat from a standing position, which is harder, would be to know how to bend at your hip first. So I'm in an upright posture position, my chest is up. I'm going to lean into it. Now I'm bending at my hip. I didn't do anything else. I can't bend my knees from here. They're stuck where they are. And recover. So once we've practiced a couple of those forward leans, chest is out, I lean forward, my shoulder blades go back like we did our arm rotation, and I'm starting to feel some weight transferring to my feet. Enough weight transferring to my feet, and now on this one I'm going to go right into a push through my legs, stand up, lock out. When I lock out, my thigh muscles should be tight. That's what locks out your knee. My butt muscles should squeeze. That's what locks out my hips. Super, super important to wake up and find those butt muscles. Now when I recover, and I want to sit back down in that seat, I'm bending just like I did on the seat. But this time I'm going to push my butt back. Chin comes forward. Hands on my thighs. Now I can bend my knees and very gently rest back down into a seated position. We're going to do a second one. Posture upright. I'm collapsing here at my torso. I'm bending at my hips forward. I've already got some weight resting on my feet. Then I'm going to drive my way through my feet, stand up, lock out, shoulder blades back, butt tight, thighs tight, recover. Now we're going to set back down. Butt goes back, means stick your butt out. Chin comes forward. My hands are still on my thighs. My knees go out as they bend, and I rest back down to the seated position. We're going to do 5 more of those on my count. Lean forward, press up, lock out, 1. Butt back, shoulders back, bend your knees, knees out, back down. Number 2, lean forward, push through your feet, stand up, lock out. Sit your hips back, knees out,